Hello, I'm Jason Renault with the Alternative Mobile Services Association, and we're here in October 2025 AMSA Talks. Today I'm with Jasmine Black. Hey, Jasmine,
Hey, how are you?
I'm doing well. Thanks
Good.
for joining me.
Thanks for having me.
We're going to talk about big projects in Indiana that
hmm
you are a big part of. But first, I'd like to ask you about yourself, and could you introduce yourself to our viewers?
Yeah, sure. My name's Jasmine Black. I'm the Vice President of Community Health Impact for Black Onyx Management and the lead of our MCAP project that we're going to talk about today. My background varies from currently management consulting services to nonprofit executive leadership for many years, state government, and nonprofit direct service work. So I've done all of the things over the decades or the time of my career. And I'm happy to be here today.
You mentioned Black Onyx Management. Tell us about that.
Yeah. So Black Onyx Management is a Indianapolis-based management consultancy firm with a focus on community. So we have clients from across the country and a few staff situated in some other areas across the country as well. But we were originally formed out of Indiana. Our company provides management consulting for a variety of service needs for organizations from nonprofit and philanthropy to help organizations direct funds and do board engagement to applied research and program evaluation, some economic development in cities and through corporations, helping them to develop good supply chains and to get loan access out to communities. And then I get the privilege of leading our community health impact team. So all of our work is helping our clients shape the lives and well-being of the communities that they're situated inside of.
That is a really wide scope for an
It is.
agency. Is it
Yeah.
huge?
No, it's not huge. So there's about 20 of us. And I say I get to work with the smartest people I've ever met across our
That's
team.
nice.
We all have so many different expertise. My team in particular are all masters in public health trained individuals and come from different regions of the country and but are all here together working to advance the well-being.
So before we talk about MCAP and your project, help not, we'll have viewers from all over the country. Tell us a little bit about what's going on in Indiana as
Mm.
far as mobile crisis and alternative response.
Yeah, so Indiana is an interesting place in the fact that it typically mirrors a lot of national averages when you look at health data, almost any of it. So when you see mental health data or suicide rates or depression concerns in communities, we're going to be right on par with what it looks like nationally, typically. In Indiana, we are seeing increased suicide rates amongst LGBTQ youth, high rates in mental health burden across Black and Latinx communities. Our rural communities face concerns around shortages of healthcare providers and surely concerns around response times for crises. And our urban areas are really concentrated with high populous areas that, again, then don't have enough providers to serve everyone. A slew of things all come together to make the perfect storm of mental health crises across any of our communities, urban or rural, in the state of Indiana. And MCAP is part of the way we're partnered with the state to address some of those things.
So MCAP, you're using an acronym there for
Yeah,
me. Spell that
yeah.
out.
Mobile Crisis Accelerator Program. So we're not the people who do the crisis response work. We're the people who help create the crisis response programs
Oh,
in Indiana.
so you're launching new programs
Correct.
and the state is helping. How does that work out? The state is
Yeah.
helping you do this.
Yeah. So we're partnered with the state of Indiana and launching this program on behalf of them to help develop new mobile crisis teams to respond to mental health and substance use crises across the state.
I'm just realizing that one of the remarkable parts about this is how fast it's gone.
feels like it's gone fast. There
To
was a
me.
lot, yes, there was a lot of work behind the scenes, and so we had about a year and a half of development before we got to actual funding announcements. So lots happened behind the scenes with us to build the infrastructure and work in collaboration with the state.
I haven't heard of other states doing this. I might be wrong, but
Me
is this
either.
unique?
I believe it is one of the first of its kind in the country. I haven't identified others, though many people are doing obviously mobile crisis work
Sure,
across
sure.
our country that we have been able to glean from to help equip the teams we're going to be building with the best tools possible.
So let's dive into the MCAP, the accelerator program. What does that mean?
Yeah, so the program provides $1 million of funding to local community-based organizations, a piece, $1 million each, um, to allow them the opportunity to staff, train, and uplift, stand up a mobile crisis response team in their local community. At the end of the program, ideally, what's going to happen is they're going to have stood up a program that can be certified by the state of Indiana, by our Department of Mental Health and Addiction Services,
Wow.
which means then that they can be dispatched by 988.
So you're probably not just talking about, what do we do on the street corner, but you're talking about the paperwork, the
Yes.
documentation, the onboarding, the
Yeah.
recruit, all
Yeah.
this.
So we're going to help them with all of that. Each of the teams is matched with a project manager from my team. And I get the privilege of having one team, so we're all even. And we are helping them through monthly calls for technical assistance. We've created 18 uh, pre-recorded trainings from subject matter experts and mental health experts to equip the teams with skills and their staff with skills and general education around crisis response. They also have access to each other and quarterly meet together to have cohort meetings to learn from one another. And during those meetings, we'll also be bringing in lots of subject matter experts to provide them additional trainings that we will provide for them. But inside of their budgets, it's also very loose. They, much unlike many other funding opportunities, have the ability to purchase what they need and to pay for what they need in order to stand up these teams. Everything from rent to an actual vehicle to respond to mobile crisis services, to staff salaries, to additional trainings, whatever the case may be. Every community needs something different, and we are trying to be responsive to that.
And I assume that they can supplement this $1 million with funds from other places as
Sure.
well.
Absolutely. If they have the dollars to do that, then they can. Part of this program, um, and I don't want to jump ahead too much, but it's also helping to make sure that we can create sustainability in these
Mhm.
programs so that once the 10 months, the 10 short months they have with us is over, that these programs can sustain long after that.
Well, let's talk about sustainability. How will they
Yeah.
perpetuate that? How will they keep going?
Absolutely. So we are going to be funding a Medicaid expert to work with them around getting Medicaid enrolled as an
Okay.
entity because crisis response in the state of Indiana is eligible for Medicaid billing. So the time in which they are responding to crisis or staff is responding to crisis can be billed, which helps to create some funding to go back into the to company to continue the services. In addition, there are grant opportunities historically that have provided support of the downtime of staff then, their administrative time when they're in the office, not responding to a call. There have been grant opportunities in the state of Indiana that have supported that. Now, funding varies all the time, but we'll also be working with the teams to develop sustainability plans so that they know where can we go for funding? What should we tell individuals? What kind of data is going to be essential in order to tell this story to bring in other potential funders?
Now, there are already some big operators in Indiana in
Mhm.
the community health arena, and some of them are running mobile crisis teams. How did you decide who you would award these to?
Yeah. So as opposed to funding some of the larger entities, the Mobile Crisis Accelerator Program is prioritizing community-based organizations or grassroots organizations that are embedded into communities already, have long-standing history and trust built inside of those communities, and are providing other services that really lean into the needs of crisis response. Once stabilization is over, or de-escalation is over and we're seeking stabilization, what an individual needs varies, and what these organizations have to offer them can help to provide them with the opportunity to prevent crisis in the future.
And as I looked at these, they were often smaller operations, operations that hadn't done anything like mobile crisis before, but had been in the community mental health space.
Mhm. Yeah. And so they were organizations that have been solving problems of their communities, some of them for decades, from housing to healthcare to food access, to small mental health programs that got individuals in their communities exactly what they needed. They've been doing that work. And so it's important to then invest in developing infrastructure that not only supports the long-term sustainability of a critically important organization in a community, but also creates infrastructure where trust already exists, which is really important when we think about mobile crisis response.
Oh, it's and that brings me into remembering that a moment ago you talked about that there's an undue burden on Black, Brown, and Latinx communities in Indiana. And how have you addressed that with these teams? I've noticed that many of them are teams that are led by Black, Brown, and Latinx people.
Yeah, yeah. It just so happens that who applied and who received the opportunities are teams that are led that way. But their mobile crisis teams will be designed to serve the needs of their community as a whole. So, and from community to community in Indiana, that looks vastly different, right?
Mhm.
Some of their response ranges will reach out into very rural areas while being concentrated in urban communities. Some of them have much higher immigration population or immigrant populations in their communities that they will need to be able to respond to in appropriate languages and culture needs. Some of the orgs have much higher number, or some of the orgs in which the place in which you're situated have much higher number of populations of Black and Brown communities, just in the nature of who lives there. And some of them don't. Some of them have predominantly white communities that are situated, all still greatly needing mobile crisis response. And so we selected teams who could provide us with um, the best indicators that they could serve their communities at large.
Well, it sounds like you're really happy with the outcome of these
Yeah.
vendors, that you
Yeah.
really got a good collection. Let's talk about them. Tell me in detail, if you can, a little bit about each one.
Yeah. So up
And
in
we'll put the links for each of these in the narrative under this video so people can click through and look for themselves.
Yeah, absolutely. Up in Fort Wayne, Indiana, or Allen County, we have Courageous Healing, which is originally a therapy practice that was founded in Courageous Healing to respond to the needs and the lack of therapist offices that existed in their community. And they are a team of mental health experts who want to engage and have engaged in some crisis needs of their communities, and want to be able to expand that to serve the entire Allen County area. So they're really excited to partner with, their local police department and build relationships there, to partner with local political figures in their communities to make it known that about the work that they want to do and the abilities they're going to have, to really bridge divides that exist through working with other support agencies in their communities that are well suited to support a person after crisis is over. And I'm really excited about their work. Up in South Bend, Indiana, right at the sort of top middle of our state, which is St. Joe County, we have Imani Unidad, who again is one of those orgs that they've existed for forever. I've known their executive director for probably about a decade, and she is one of those women who get in the mud with their teams to solve problems. And that's what their organization has been doing for quite some time, solving community problems and ensuring that gaps that exist in their community can be filled any way that they can fill them. So, though they don't have mental health practitioners at current and haven't done direct, therapy practices or crisis response. They've led countless amount of support groups for people experiencing mental health concerns in their communities. They've done outreach programs to reach those who have been really critically difficult to reach, but have high needs in their communities for a variety of health concerns. And so we're really excited for them to be able to have this opportunity to have funding infused to them that invest in their organization to build the sustainable. So up in Lake County, Indiana, which is the northwest side of our state, so think Chicagoland, but Indiana, we have two organizations that we have funded, which is really exciting. And they are really excited to collaborate in ways that don't currently exist in a lot of mobile crisis response areas because they will have overlap. And so there is a lot of forced collaboration in their response. But we have Aliveness Project of Northwest Indiana, which again, I've known their executive director for about a decade, and she is an amazing woman who has led that organization for, I want to say 27 years. And the organization at its core was developed as a response to the AIDS crisis. And needing to provide services that supported individuals living with HIV and the expanded social concerns that exist with an individual living with HIV, which
Mhm.
can be mental health needs, food needs, access to medical care, all sorts of housing concerns. And so they have been well equipped to respond to a person's whole being, which is important when we think about mental health response and mobile crisis services, because again, we're trying to prevent crises from occurring um, many times over in one individual, which means we have to address the person in full, address their housing concerns, address their food access concerns, their safety in their community. And Aliveness Project is well situated to do that work. And then also up in Lake County, we have Sounds of Sarah, which is just such a passionate group of people who originally developed. Their founder, Patty Stovall, lost her daughter to the substance use crises and originally created Sounds of Sarah as a response to that, to help get information about substance use prevention and harm reduction to her community to help save the lives of other people's children and family members. In their community. And so they are very well situated to think about mobile crisis response and the needs that typically arise out of crises and why they arise. Because it's not always mental health, though many substance use crises have mental health elements. But we have an opioid crisis in the state of Indiana, much like the rest of the country. And Patty and her team at Sounds of Sarah are very well equipped to respond to that type of crisis in their community, as well as bringing on mental health practitioners to respond to mental health crises. Something fun about them is they're also going to be working to develop an app about crisis response through the use of some of their grant funds, and so we're excited to see how that develops and how it will benefit not only their community but other communities. Down at the toe of our state, we have funded ECHO, which they are in Vanderburgh County in Evansville, Indiana, and they are originally a group who predominantly has a focus on addressing housing needs for individuals
Mhm.
and those individuals at greatest risk of homelessness, which aligns really well with mobile crisis response as we think about the high number of individuals that are currently unhoused, not only in Indiana, but across our country, due to the skyrocketing price of housing and the economic decline and job loss and, all of the things that lead us to homelessness. And coupled with that, often is some mental health concerns, whether small or, much more medically much higher medical needs associated with them. And so they are very well partnered in their community with the desires of Vanderburgh County to address mental health crises. So they have the support of their local law enforcement in doing this crisis response work, as well as a partnership with Southwest Behavioral Health Hospital, who has practitioners and other health services that they can partner with to make sure that people get long-term care after they de-escalate their current crises. So we're really excited to have them a part of this program as well.
Well, these all sound excellent. And all startups, all agencies that are established coming into the mobile crisis frame. I've seen a lot of people look at this problem and say, well, we'd like to get into this business. We're excited, we're motivated, but then just it's so daunting. I mean, dealing with the state, dealing with the county, dealing with the hiring, the money, the sustain, all too difficult. So this is just wonderful that you have this framework to build up these programs. What would be your advice to other states wanting to build mobile crisis fast?
Yeah, I would say find a really great partner who can be that sort of catalyst to organizations in their communities that can also demystify a lot of the process, support them in the technical aspects of mobile crisis response, and as well as the financial needs of mobile crisis response. I would also say it doesn't go without investment. So the state of Indiana is investing millions of dollars in making this program happen. And that is critical because mobile crisis response isn't cheap. It's
Can
not.
you, can you
Yeah.
talk for a minute about how that came about, how Indiana came to be? And really, Indiana is one of the national leaders in
Mm.
mobile crisis. It may not feel like it in Indiana, but that's maybe in
Yeah.
comparison to other states that have done little
Yeah.
or nothing. But
Yeah.
why Indiana? What happened in your state legislature?
So I can't point directly to how the legislature made that decision. I can say that our Department of Mental Health and Addictions is largely where this is derived from,
Mm,
and they were seeing that all the things we talked about. It was difficult for teams to start mobile crisis response. The most well-intentioned teams who wanted to get up and going, who were trying to engage with them, they just couldn't get off the ground or couldn't create sustainability. And so they had another program that they were doing with nonprofits across the state that was an accelerator type program that really was just about building the capacity of organizations to
okay.
support mental health work as opposed to mobile crisis work. And that went so well
Hmm.
that they came up with this idea to do this mental crisis accelerator program, right? And thinking about mobile crisis teams and how we help organizations accelerate to that. And we were already partnered with them doing some other work around an evaluation of 988 in Indiana. And had the opportunity to present what we thought we could do to address the Mobile Crisis Accelerator Program, and we're able to be selected for that. And so we are just, I mean, really thrilled to bring this to life. To be honest, this has been my sort of baby a program. I was brought on to the company. I left my job to come to Black Onyx Management to help them with this in particular. So, in addition to growing the service line to address community health needs as a whole, this program was the thing that the catalyst for me to leave my previous job and say, I want to help address a statewide concern because I was seeing that in leading a nonprofit, seeing individuals come in every day without the support for and the support necessary for crisis response in communities, and knew that creating a program that could serve the state as a whole, but also could be replicated here in Indiana again and again, and also all over our country. That we I do believe that this can work across the country, but it will require the investment of health departments, of uh, uh, mental health and addiction services departments, of family and child services offices, of your state legislator, right? Your state legislators, it will require financial investment. But I think that getting a good team in place who can lead this work is a great place to start.
Well, it sounds like you're the captain of a solid ship and you're off on a great adventure.
I feel that way. I am lucky to have a really great team, and lucky to have known tons of experts that I can also lean on, and bring them in when necessary to provide support to this program, because it's not a one-woman show by any means. It requires countless hours and support for these teams, to help them feel equipped and ready, because they're taking on a huge endeavor to serve their communities.
Well, Jasmine Black, thanks for talking to me today. I hope we can
Yeah,
talk again in a year when you've got this evaluation and these teams are up and
yeah,
running.
me too. Thank you.